Hi, today we are going to see about case study on X-rays. How does X-rays works and what are the cases we have? Okay. Introduction. The range of densities one is attempting to image on a chest radiography is larger than that any other site in the body. Okay, the range of densities one is attempting to image the chest radiography is larger than any other any other site in the body, ranging from very dense to very low densities air filled lungs, which is the range from very dense to very low density air filled lungs. As a result, the quality of CXR is very dependent on the technique used in this production. Okay, the range of densities in attempting to image on chest radiography is larger than that any other site in the body. We already know that a chest is a very dense place, which is very difficult to take the radiography. Next, preliminaries for chest X-rays. A, B, C, D, E, F. We have all these. A is for AP or PA view. A is for AP or PA view. B is for body position. C is for confirmed name. D is for date. E is for exposure, and F is for film for comparison. Okay. Preliminary tests for X-ray. Chest X-rays A, B, C, D, E, F. We have these components. A is for AP or PA view. B is for body position. C is for confirmed name. D is for date. E is for exposure, and F is for film for comparison. Unilateral pulmonary effusions. Okay. Radiological findings. Track and mediastrium shifted towards right. Okay, dense homogeneous opacity in left lower zone. There is obliteration of costophrenic angles, CP angles they used to tell. Okay, these are radiological findings. Triax and mediastrium shifted towards right. Dense homogeneous opacity in left lower zone. There is obliteration of costophrenic angles, that is CP angles. Radiological diagnosis. Left side pleural effusion. Okay, left side we have pleural effusion. Common causes: pulmonary tuberculosis, pulmonary infractions, parapneumonic, bronchial carcinoma. Okay, these are the common causes. What are the common causes for these symptoms is that pulmonary tuberculosis, pulmonary infraction, parapneumonics, bronchial carcinoma. Bilateral pleural effusions. Okay, this is before we have shown the lateral, now we are going to see the bilateral. Radiological findings: dense homogeneous opacity with curvy linear upper border in both lower zone, obliterating both costophrenic angles. Okay, dense homogeneous opacity. Radiological diagnosis: bilateral pleural effusion. Okay, causes is cirrhosis of liver, phenorotic syndrome, congestive cardiac failure, bilateral extensive tuberculosis, pneumotonic arteries, and SLE. Okay, we have shown the bilateral symptoms and lateral pneumonic fusions. Radiological findings: we have dense homogeneous capacity with curvilinear upper border in both lower zone and bilateral both costophrenic angles. Okay. Radiological diagnosis is bilateral fural effusion. Causes, what are the causes we have is cirrhosis of liver, nephrotic syndrome, cognitive cardiac failure, bilateral extensive tuberculosis, pneumatoid arthritis, and SLE. Thank you.